And I moved to Crimea again.
If I'm 17, that's 18 years ago. Many people say COVID is fake. COVID doesn't exist. I have friends that are bulking right now, and during lunch, in school, they're constantly eating. So is coffee good for a person?
Yes.
How many coffees per day?
4, 5.
Is good vaping or cigarettes?
3, 6 months, and you will see the changes.
Do you think gym is important?
Yeah, all the physical activity is important.
Physical activity. I'm not doing any physical activity.
Darling, I will change your habits too.
So hello, we have Dr. Maya with us today.
Hi,
I'm very
darling.
happy to have you here. Thank you for coming.
Thank you that invite me.
Yeah.
And it's very interesting.
Thank you. Could you tell us a little bit about yourself? What is your profession and what are you currently doing?
I'm a doctor.
Mhm.
A lot of people know me as a Dr. Maya. I'm a pediatrician last 17 years. I'm from Ukraine. And I'm from Irpin city, and I came here 1.5 years ago.
Okay. And are you working as a doctor now, or are you by yourself, like private or something like that?
Unfortunately, in Cyprus, little different system of medical help, and I need some time to recognize my diploma. Unfortunately, only my experience is not enough here, but in the future everything will be okay because I start learn Greek, and it's just time. And I can tell you that I will do everything to be a pediatrician here in Cyprus. Now I continue my online help. I'm online doctor for every people all over the world because I can help a lot of people with different diseases, and we can speak Ukrainian, English, Russian, doesn't matter, but international doctor. And I continue my private business in Ukraine. My clinic is located in Kiev region, and I continue to control online. So everything under control.
Which is really great under our circumstances right now. For how long have you been a doctor?
17 years. I graduated my high medical school in 2006.
Okay, so that's, if I'm 17, that's 18 years ago.
Yes,
so
but
you have been a doctor for a while.
Yes, and after my university, I had some internship, like practice, and it was my first time when I decided to visit Cyprus. Can you imagine? First time I've been here in 2007, and I practice, and I wanted to see what the system in Europe, how the doctor work, and I came to Cyprus to catch some sun on beach. And saw some information and find some information about clinics, how it works. So I couldn't imagine that in 15 years I'll come back.
Are you enjoying your time here? Do you think you're happy with the place that you're at?
It's an amazing place. I can tell you that I like Cyprus very much, especially people here. They're very friendly. The life here is not very stressful, and as a doctor I know that the biggest advantages in our life is our lifestyle, We should have excellent high quality food, excellent air, excellent water, excellent people. We should reduce our stress, and we should have excellent education for our children and safety place.
Yeah, that makes sense. Хотите перейдем на русский?
No, I don't think so.
No?
I think
Okay.
we'll continue in English.
Okay, we can continue in English if you want to be like that. Okay, so you're a pediatrician, right? And where did you get your degree?
After my university, we have just general practice like pediatrics, pediatrician. And after I decided to have some researches, and before I change one city, I already been a PhD, I'm PhD, and sometimes, some period of my life, I was a teacher at high medical school for Arabic people from India, and I studied them pediatrics, And after I was working in a government clinic, and I decided, no, Maya, you need something more. And I moved to Crimea again.
Mm-hmm.
I moved in this area in Sevastopol because it's excellent climate there.
Yeah.
And I decided, okay, now you have some experience, you have some knowledge, so try to open your private clinic, private doctor's studio for the beginning, just try yourself.
Yeah, which I think is showing in what you're doing right now, because I can see from your Instagram page that you're really into medicine and you're really into like developing your own, I guess, like how do I say this? Okay, I'm thinking in Russian and I'm speaking in English. That's the problem. Auditoria?
Your followers.
Your followers, the people that look at you, and that. But you're basing your content in medical, I guess. So, you know how Instagram is like very, I guess nowadays you have to be on Instagram to develop yourself. And you also said that you have a business, right? What is the business about, and how is it still working in Kiev while you're here?
I can tell you that when I opened my first clinic in Sevastopol, I didn't have any social media, and I can tell you that I didn't like it. Even I didn't like to took my photo.
Yeah.
I hated this. I say no chance. I am not a model. I'm not a singer. I don't care why I should show people what I eat, what exercise I like, where I live. So it was forbidden for me. And all this year, nobody knows who is Dr. Maya, only my patient. And it was very popular because Crimea is not a huge place, and people was coming from different cities, even different countries, because they came to see, checked for Dr. Maya, and everybody was happy. But when I moved to Kiev, my daughter was born in Sevastopol 2013. After 2014, all these problems, we moved to Kiev, and Irpin area, it's very small place, very close to Kiev.
It's under Kiev, right?
Yes. Because I needed an excellent climate, and I decided to live in the forest and use my bicycle to go to home from clinic to home, so it's not necessary to use the car. So if you want, you can drive your Mercedes, but if you want to use your bicycle, it's excellent too. And I decided to live in this area. It's 20 minutes from Kiev, so everything under control. But nobody knew me. Who is Dr. Maya? In that period, I was Maya Viktorovna.
Okay, so that's your full name?
Yes,
Maya Viktorovna.
Rusilevich Maya Viktorovna. And when I came to Irpin and I opened my second clinic, nobody knew me in this area. And I decided to be European doctor, progressive doctor, very active doctor. And in that period, my Instagram page appeared. And I separated my business name, because my clinic named Be Health, and Dr. Maya. It's two different brands.
Okay.
And I decided if I want to stop or I want to change something, always will be Dr. Maya. It's me.
Yeah.
And in that period, I started my Instagram live, and I can tell you it was awful. I made my first video near the clinic, 40 minutes, and I say, oh my God, people look at me, say, is she crazy? Oh my God, I have so long nose. Oh my God, I'm so ugly,
Yeah.
And I delete, and I couldn't.
You couldn't post it? You couldn't find the right one to post?
I didn't want, but I decided who will visit my clinic, who will find me, how they can find me, because it's million people, huge city, and who is Dr. Maya? Zero. And I decided if you want something, you should do it regularly. Every day post, every day stories, you like it or you don't like it. And I start my clinic from zero, my brand name, Dr. Maya. Okay, I had only experience as a doctor, and in 2 years, everybody knew Dr. Maya, everybody knew my clinic, and because I had 3 specialization. I'm pediatrician, I'm allergist, I'm pulmonologist. So all the people with allergic diseases, pulmonary diseases, pediatric problem, they can visit me and I can help them.
You know what Cyprus really lacks of? Allergists.
Yes.
Allergists. There's only 1 or 2 that I know, because my brother, he's 7 years old, and he was like severely, I can't say ill, but when he was born, he had like this thing where he can't eat gluten. So he had to eat everything gluten-free, and there was no allergist in Cyprus. Nothing.
And
We're
now the
literally
same
lacking
problem.
of it.
Now the same problem we have here, and you should wait 7-8 months to visit allergy. And for this reason, because now I'm online doctor, it's very convenient, it's very easy to find out your answer for your question. A lot of people contact me and say, Dr. Maya, we have these problems, can you help us? And I know that in this situation I can help. I can check the test, I can see rash, a lot of things, it's like online advice.
Yeah.
And even I opened this company here with medical advisor, so I can give advice. Some lawyers can give advice,
Yeah.
and some doctors can give advice.
Okay. So how are you qualified? Are you qualified here to give advice? Are you
No,
allowed
I
to
can.
give-
I open already company, and I'm in the procedure to open my office. But
Okay.
I can tell you that last year, I'm the person. If they say to me no,
Yeah.
I say okay, this no, but in the different case it will be yes.
Yeah.
And for this reason, I started and I finished already course about healthy life specialist, because it's like consulting about medicine. I can help the people reduce the weight. I can change their lifestyle. I can make like checkup. Okay, I cannot make some injection, for example, as a
Yeah.
doctor now,
Yeah.
but I can help a lot. And I think in medicine you should be a professional one too, because it's health,
Yeah.
and everybody needs health care support everywhere, all
Yeah.
over the world.
Yeah. So when you came from Ukraine here, how many followers did you have?
I think the same. I think maybe 60,000. So
But now you have 67.
Mhm.
I don't know, when did you reach 67,000?
Nobody knows. Sometimes I already don't even check
You don't
my
check?
Instagram page, because all the time you find some new followers, some people you don't like, because maybe you show your life
Yeah.
and they don't like your life,
Oh,
or they
sorry.
say it's too much Dr. Maya in my page. And
Yeah.
for me, because it's page for me,
Yeah.
I don't care. I want to show real Dr. Maya without filters and with my thoughts.
Yeah. I look at your Instagram page and you're very live, you're very open, which I think is one of the most important, especially if you're a doctor. I feel like you have to show your real life, how it is, how things are, and medicine is medicine, you can't really fake it. You have to show the real medicine. But okay, you're also a mother, as we said before, and you told me you became mother in a young age.
Not young. I was 30, darling.
You were 30? Okay, my mother was also 30. 30 is young. Or you don't think that... Okay, this is an interesting question. Do you think 30 and above is an old age to have a kid?
It's excellent time. Now I'm 40, and I can tell you, now I have my plan in the future,
Yeah.
And I think it's excellent time, because I already had everything in life what I needed. I was high educated. I have this experience. I was PH.D.
Yeah.
I had specialization, very good profession. So why I cannot be mom? I just tell you that it's okay anytime when you want.
Yeah.
And for this reason, I'm very happy. And this is one of the most important reasons why I'm here.
They told us I take biology in school just because I didn't have a choice for a subject. I'm not going to become a doctor. But they told me, actually my teacher told me, that women that give birth before 30 have a lower chance of getting cancer. Is that true?
It's a little... Yeah, there is some knowledge about breastfeeding.
Breast cancer. I think we're
Yes,
talking about breast cancer.
Yes, because all the women who have breastfeeding, they're excellent. We should do it, but there are a lot of question mark situation. For example, me, I had a cancer when I was 23, and
You had cancer?
Yes, I don't have thyroid. You see?
What?
Yes, I
You had cancer?
Yes.
And what? No way, you had cancer.
Yes, I had thyroid cancer when I was 23, and one I don't want to say stupid, but I can tell you not clever doctor told me you cannot have a children in the future. You have a lot of problem with your health, so forget about it.
When did you find out that you have cancer?
When I was on the third year in medical school, and I had like radiology course, and they told us some information. If you have a symptoms like this, it can be cancer, you know. And I find these symptoms.
Yes.
I went to doctor check. They told me everything okay. I had something in my mind. I went to another clinic to have a second opinion, and they told me you have a cancer. I said, what? 23 cancer? And in that period, I had only one question in my mind.
Yeah.
Maya, okay, I hope you have 6 months. In 6 months, you will finish all your things, what you should do. Now just think what you will say your mom, how you prepare your mom for this news, you know. It was only one thought in my mind. And after I passed everything, chemotherapy, a lot of things, it took 2 years of my life. And when I was in university. And after I decided, in some years I stopped my mind about baby down in the future because the doctor told me it's not possible.
Yeah.
But I decided to be a clever doctor, and for this reason I think I'm a good one, and I can tell you I'm a good one because I spent a lot of time for my education, because that doctor who wasn't right and he could change my life, you know. And if I didn't check this doctor and I didn't I bought a book about endocrinology, gynecology, and it was from America, and it was information that if you do a lot of procedure, if you check your hormone level during the pregnancy, everything will be okay.
Yeah.
Just more attention. And can you imagine my pregnancy? Oh, I was with my teacher, English teacher. We translate this book because I didn't have enough English, you know. I didn't not good level.
You didn't have enough knowledge.
Yes, and we were reading together all procedure, all changes every week. And you see now I have excellent Yanina.
Yeah, you have one.
Yes,
kid.
yes,
Okay.
one. And you know why one? Because all the time I had some problems, you know, in my life.
Yeah.
I moved from Lugansk to Sevastopol. In Sevastopol, built everything: house, clinic, client, job. After I moved to Kiev, European again, built everything new. And after all this situation, I moved to Cyprus, and now I try to build third time in my life.
Yeah. How do you feel being a mom?
Excellent, you know, amazing.
Excellent.
And I can tell you this is the so excellent feelings. It's responsibility, and I want too much to see my daughter better than me, you know.
You said she's 10 years old tomorrow. So has the переходный возраст started? How do we say that? Переходный возраст? I guess it's the teenage years. I don't know if we have a word for that in English, actually. Borys might know. But has it started yet? Because I remember, oh my god, I got my period when I was 9. So early. So, like, I feel like
and what do you remember?
Huh?
What you remember? What you was with?
Adolescence.
Nah.
Yeah. Adolescence, yeah.
Nah, it's teenagers.
It was horrific. It was terrifying. I feel like from when that started until like the age of 14, I don't know, it's probably hormones, but it was constant fighting with my mother. It was constant hiding things. It was constant fights. We would never stop fighting. Never stop fighting. It was just, you know, it's like when you have a constant dilemma between you and your parents.
I didn't notice anything until now. Maybe from tomorrow I'll start noticing something. Who knows? Only one thing. Mom, please don't come to my room. I would like to change. I want to change my clothes. And I said, darling, what are you doing? Don't come to my bathroom, please. Mom, I'm changing my clothes. For me, it's strange. But, you know, if I say, darling, tomorrow we go we'll make your blood test, or we'll do vaccination, or we'll visit dentist for hygiene, to mom, it's acceptable, you know. They cannot say to me no.
Because you're a doctor, so
and she knows the rules. For tomorrow, we visit supermarket today. So, darling, I order cake, but you should buy some fruits for tomorrow. And when I saw our bin, the shopping bin, berries, fruits, no chips, no snacks, you know. only healthy food. I say,
Yeah.
bravo, Dr. Maya, you know?
Yeah.
Because I told my daughter, you can choose the food for tomorrow birthday party.
Yeah. So it's based on her, but I guess because she's raised because of a doctor, she can see.
And
That's
we
also another benefit, you
And
know?
we should translate this to other people because
Yeah.
now we have a serious problem with obesity, overweight people everywhere, a lot of diabetes, heart problems. And I can tell you in Cyprus, I already noticed a lot of problems and I want to change it, you know?
Do you think it's gonna get worse? Because
Yes.
we eat a lot of meat. We eat a lot of pork. Personally, by the way, my mother is always against pork.
Bravo.
She tells me don't eat pork. I never eat pork. I very rarely eat pork. Like it can be once in like 6 months and by accident, let's say, you know, because there's nothing else on the table. But for some reason she always tells me this is my mother's like a doctor, you know. If you come to our house, we have maybe
I saw,
five,
darling.
you see, yeah, five like drawers of pharmacy. Whenever I'm sick and whenever I was sick, she always took me for a blood test. I never understood that. Whenever, yeah, pork, no pork, not allowed. What else? Whenever like I had anything on my body, straight away to the dermatologist or something like that, you know. So it's a bit of a hustle.
Yes, I agree. But now you have Dr. Mai next to you.
Yes.
So it's gonna be okay.
I feel like that's a good part. My another question is, because I always had that as a dilemma when I was a kid. When you're sick and you have a virus, is it better to go and take a blood test to see what's going on, or is it just fine to be sick and go with the flow?
It depends, you know. If, for example, you have a runny nose, you sneezing, you're coughing, and you just feel just first, second day, not very high temperature, you can control it by ibuprofen, for example.
Yes.
So your blood test in the beginning maybe will not show anything because your immune system didn't have any response. But if we have, for example, sore throat and we have tonsillitis and we need to make a swab and strepto test, rapid test, to recognize if you need antibiotics. So it depends. For this reason, you should have your doctor that can manage all the symptoms like puzzle, you know?
Yeah.
Because we don't have one answer for all questions. For example, if it's acute viral infection, you don't need anything. Water, rest, humidity, nothing else.
Yeah.
But if it's flu, real flu, you should have your test and use special, like Tamiflu, for example, medicine,
Yeah.
understood?
Yes,
So
yes.
how you can recognize if it's flu or acute viral infection? But me as a doctor, I know the symptoms. For example, Tamiflu has a 40 degrees, 13 degrees. We cannot reduce it with using Nurofen. Or, for example, you have so huge pain, muscle pain, headache. You cannot open your eyes. You know, a lot of symptoms.
Yeah.
So for this reason, you need somebody like be in contact with some doctor, just analyze the symptoms.
You know, my mother, because we live here, but we always had contact with, there's this one specific doctor, Elena Petrovna from Kiev. Whenever I was sick, and whenever I am sick, and my brother as well now, because he's small, not only getting the opinion of Cypriot doctors, she goes to the opinion of the Ukrainian doctors, and we always do the opinion of Ukrainian doctors, you know? So I feel like, personally, I feel like the medicine here is not as good as, let's say, the medicine in Ukraine. And I think that's an issue. And I know that that's an issue because also a month ago, I had pain. And then they realized that I have a cyst. I went to the doctor. And he was like, okay, tomorrow you're going to have a surgery. And I was like, what? Why? Like, why? Like, it's a cyst, you know? Like, people give birth with cysts. Like, people, you know. Anyway, I went crying home. And then my mom calls me. She's like, you're going to take the antibiotics because there's no reason for you to do a cyst. Do you think doctors in Cyprus are not well educated enough?
Oh,
it's a very hard question. I know that I put you on the spot.
Yeah, but I just want to answer one question. Your question, like with one phrase. When I visit international conference,
Yeah.
we speak about, for example, asthma. And I ask, where is the doctor from Cyprus?
Yeah. There
Nobody
is no
knows.
doctor from Cyprus.
See, and say, please, Mike, can you introduce us in Cyprus? I say, when I recognize my diploma, my education, we will see. And I just tell you, it's a good idea to have a second opinion. because I think because there are a lot of doctors and it's very difficult to have this diploma here.
Yeah.
Doctors have excellent life here and they don't care about anything.
They do, because they have the system of GSI, and whenever they find the chance to cut someone and get money, they do it, you know? But that's what I don't understand, because
I'm very happy I don't know the system now, and I have just insurance from insurance company. No, I don't know all the system, but I saw some prescription. You know.
Do you know what the system is maybe about? Because what I understand, okay, I'm not a doctor, I'm not in GSI, but what I understand is GSI is like a government program where you enter it, and you're as a doctor in it, and you get paid from GSI. So as more as you do and you plug it into GSI, the more you get paid. That's why some doctors actually, and the quality of medicine gets lower. So also in the pharmacies you pay less, but it profits more than GSI, you know.
What I saw, a lot of children, they are prescribed a lot of medicine, you know, from for example serum for cough. For what reason we need it? If we can drink, no, we can drink tea, you know, with honey. So, or for example, antibiotics without analysis, or steroids. And for me as a pediatrician, I cannot accept this, but I cannot analyze the system because I'm not in the system and I don't know all details. It's European rules, and we hope in the future everything will change, because you saw how many Ukrainian came here. So maybe for example, in Poland already my doctors from my clinic, they already work. In Dubai, they asked me, Maya, please come to Dubai. You can open your office, but I don't want to come to Dubai, no?
Yeah, you want to stay here.
Yes, and I will stay here.
Sorry. Yeah, no, I understand you from one point of view. Do you think in private hospitals there should be qualified doctors in every single second and in every single sector, let's say? Like good qualified doctors, because I have a really bad experience here.
For sure, and I can tell you, if I will have any problems with my child, I will do the same. I will visit these private doctors or government hospitals, you know, because we don't have any choice.
Yeah.
We should do it, you know. We have a problem and we must.
Something that really surprises me, do you know St. Raphael? Okay. In May, I came back from Greece. And I came in the night, and then I ate meat. I went to sleep, and I woke up with a really bad pain in my stomach. I went to my mother. My mother gave me Spasmagon, which helps always, or Malox. And I went to the water park that day with that pain. I came back home, and then the nanny of my brother, she tells me, it looks like you have appendix. And I was like, shit, you know. And I went to the hospital and they admitted me in. And the guy that was doing my CT scan or whatever it's called, I'm not sure, he told me that I have a stone in my kidney. Like, how can you not see from the CT scan that it's an appendix? You know? And they delayed my operation for a whole day because of that. So I think working in a private hospital, this is my personal opinion, okay? I'm not a doctor. Working in a private hospital, checking a CT scan, telling your customer that he has, I don't know, a stone in their liver or whatever, it's a bit bizarre, you know, because appendix, like, it can bloat, I think it can bloat in your body and then create even more issues. So, you know, if my CT scan wasn't sent to another doctor, then I would probably, you know, end up with something much worse. Do you think those issues have to be handled by the government, even though it's private hospitals?
Well, I think we cannot put in a different plate, in different hand, private and government clinic. We should find a solution for general medicine, you know, system here. And I can tell you that now there are a lot of doctors here. Even I know they're in Cyprus now. Maybe in the future we can change something altogether, because now it's not possible to pass all this exam, to do all this procedure. Can you imagine me 7 years from the beginning, start my education, 7 years, it's very difficult. Okay, they told me you can go to Nicosia University and be a teacher because you're a PhD. But I don't want to be a teacher. I want to be a doctor.
You want to be a doctor. Yeah.
But for example, now I have my colleagues here and they have online service about CT, about Röntgen. So we can have extra another opinion about CT, for example. Just send details online and check the doctor. But I don't think it's okay idea to check the doctor. But it's your health.
Yeah,
It's like second opinion from lawyers.
Yeah. What do you think about COVID?
Oh,
is COVID a fake story? Because many people say COVID is fake. COVID doesn't exist.
No,
COVID
it was because I saw a lot of complications, and I remember them when the COVID was in the beginning. I remember that every day 4, 7, 8 pneumonia I saw in my patient, and for sure it wasn't flu. And I think we'll have problems in the future a lot, because now I see viruses, they're different already, and a lot of complications, a lot of severe allergy reaction. So now we have to care more about our health, about preventive measures, preventive medicine. And for this reason, I told you, I finished Healthy Life Specialist, this course. And next step, I think I'll do it in UK, because we should prevent a lot of problems.
Yeah.
We have so difficult life now, no?
So would you say that COVID, I think, I know that every person takes it differently. Like, it depends on your immune system. But can COVID, cause pneumonia? I think it does, right?
No, it was pneumonia. Everything, changes in your immune response, and even allergy, can appear after COVID, but we cannot do anything.
What about the vaccines? Do you think they're valid? I know someone who got cancer because of the vaccine. In USA, actually. He got cancer of his heart. He did the vaccine, and then in 2 months, it started, beating really fast, and they went to a doctor, and it was, stage 2 cancer. I never got vaccine though.
But I'm a doctor. I had 3.
Okay.
And I can tell you, all the doctors have their own opinion. It's like evidence-based situation, and we cannot say no, because the medicine divides in 2 directions, evidence-based, and somebody told something,
Yeah.
So I am normal one, evidence-based, and if there is any researches, any dates, facts, I should listen to this.
Do you believe in vaccines though?
Yeah, for sure. All my
All your children,
all my daughter, and all my patient, of course, against pneumococcal, for sure.
No, pneumococcal for sure.
But how we can realize what is good, what is not? If we discuss and try to discuss about COVID vaccines, it's a lot of questions, but I had.
Yeah, because there are 3 different or 4 Johnson Johnson, that's one for sure.
Pfizer,
Moderna, and then there's I think those are the top 3, to be honest. I'm not sure about the others. I'm not even sure if there are others. I'm skeptical about. I never did them. I never risked. My father wanted to have his 4th shot. We got him not to do it because I think it's a bit dangerous, to be honest.
I have 3, but this year and last year and previous, all the years, I have the vaccine against flu, flu shot, and I can tell you we should do it.
No, flu shot, yes. I also had the flu shot, so I mean, it's it's not vaccines. I feel like vaccines should be implemented, but only unless the person wants to do it. It shouldn't be forced.
I agree.
For sure.
It's like if you want and you like smoke, but you should know the result, And I always say cut off, please. And you cannot imagine. When I see the child overweight or the woman smoking next to the child, you think I come to see and say, please, can you stop smoking next to your child? Say, come on, who are you? You know. For me, it's very important. Some people they can't understand the important things, and they try to explain this. And for this reason, I have my professional blog about medicine and lifestyle, because we see a lot of bad things everywhere: junk food, drugs, addicted people, everything. No? Some people should show something good.
Smoking, vaping, or cigarettes?
Oh
What
my
is
God,
worse?
nothing. I am a pulmonologist, and I can tell you that what I have seen on CT after vaping, it's awful.
How long do you think you need to vape for
Oh,
to see your lungs in a
3,
bad?
6 months, and you will see the changes. No, I just
Yeah.
tell you that this is lifestyle, always. I didn't have any habits, bad one. Okay, I tried everything because I was a student. I was living in hostel. But I always have in my mind that I want to be in 60, look like I'm 50. And for this reason, I push myself. Exercise, good food, enough sleep, good quality of life. For me, it's very important. And for this reason, I'm in Cyprus too.
So both are bad, smoking and vaping. Because
Both.
what about IQOS?
The same.
The same thing.
And kalyan, what the name
And
in English?
shisha. We're talking
Shisha.
about shisha.
Shisha.
Dumb. Because I've heard, I know vaping is worse than smoking. I've heard IQOS is better than cigarettes.
No, it's
And I've
just
heard
everything in our
shisha
mind.
is better than anything else in this whole entire world.
No. And this is our problems. It's like sugar, you know. Some people cannot stop eating sugar. Some people cannot drink coffee. But coffee, it's okay if it's high quality. But cigarette, we cannot find a good one or bad one. Everything off.
So is coffee good for a person?
Yes.
How many coffees per day?
4, 5.
It's good. It's
Yes,
okay.
if we
I'm drinking
Yes,
2 and I think it's a lot.
No, it's okay. Only the without sugar. If it's with milk, it's better to have this coffee not after food, not during the food, like for your dessert, you know.
Yeah.
If you put sugar, it's not okay.
Mm-hmm.
Without sugar, it's okay.
What is the best coffee that you can drink that is healthy for you?
Here I'm drinking from Zoropos, you know, cappuccino with
Coffee Berry. We're talking
coffee berry.
Coffee Berry is the best
Yes.
coffee shop in Cyprus, but I have to say, in Nicosia there is Red Sheep that beats everything else. Beats every single coffee shop that there is in Cyprus. You should try it. When you go to Nicosia, try Red Sheep and you're gonna understand the difference. I think it's the coffee grains that they deliver, you know, and the way they don't burn them. Because, for example, Coffee Island, their coffee is shit. Their coffee is crap. But I take the coffee from them here because I live here, you know. But it's burnt. You can feel that it's burnt. Also, I've heard that Americano is not a good coffee for you to drink.
No, it doesn't matter.
It doesn't matter.
Americano espresso only. Don't put sugar.
Mm-hmm.
And if you use a milk, okay, I don't regular milk, normal milk I never use. But if we speak about coconut milk or wheat meat, just have in your mind it's your like food. Because when you drink coffee after food, all iron that you receive from the food disappear. Because coffee destroys everything, you know. And it's excellent one. So every person have know their limit. For example, for me, it's 1, maximum 2 small cappuccino per day, and it's my enjoyment.
Yeah, okay. Well, it makes sense. My mother, she used to drink 6 or 7. She narrowed it down to 3 because I also think it affects your pressure rate. Yeah, that's a problem.
Only not syrup, not extra form, you know.
My go-to drink was iced caramel latte.
Oh no, chance.
It changed to cappuccino because of Borys.
Bravo, Boris.
But yeah, it changed to cappuccino. But my mother, you know what she does? She drinks Americano and then she adds an extra shot of espresso. How does that work?
It's
Like,
too
you
much, but if your heart and your
Yeah.
nervous system need it, it's like some energy. But I can tell you that there is here very important the quality.
Yeah. So would you think Coffee Berry is the best place in Cyprus to go to?
What I found here, yes.
I think so too. Do you agree? I think so. I think so too. I think Coffee Berry makes the best quality of coffee, to be honest, and it also tastes good.
And I can tell you, always I took a small cappuccino. Everybody asked me, why not medium? I say, because if I was drinking medium, coconut, it's fat, I'll be bigger,
Yeah. Why medicine? Why did you decide to go into medicine?
Oh, I couldn't imagine. Me to be not doctor, for example, lawyer or actress, no chance. I liked when I was child. I helped all the homeless people when they cut their legs. If mom couldn't find me outside, they said, okay, it's time to go to pharmacy because I like the smell.
Yeah.
I came to pharmacy because when I was young,
Mm-hmm.
the pharmacy was different,
Yeah.
They made some medicine inside and it was excellent smell. And after I decided, I left from my house, when I was 14, after 8 years at school. I moved, I couldn't cook, I couldn't do anything, but I wanted too much to be a student in high medical school. And 3 years I was living without my parents in different city, just prepared like was medical college before medical university. 3 years without parents, but it was very excellent experience. Now I can survive everywhere, in any place. If tomorrow you tell me, Maya, let's go to Africa and start from zero there, I can do it too.
Are doctors highly paid?
Oh, in that period, when I saw the doctors, I remember I came as a patient, in clinic, and I saw how awful was the doctor's shoes. And I say, oh my God, how is possible? And so bad room, everything so cheap, And my mom told me, darling, you need 6 years for your study, Your study will take you 6 years. And after 2 years, it's internship. So 8 years. In 8 years, everything will be different in Ukraine. The salary will be good. It's excellent profession for women. So let's do it. And in 8 years, nothing changed. I came to the same clinic, the same doctor, the same shoot. I say, oh my God. And I decided, Maya, start be a cleverer than other one. And this was my point why I visit a lot of international conferences. I came to Cyprus even for practice. Can you imagine? I came to Ainapa, and all the girls my age was on the disco, And I never visit any disco in Ainapa, but I visit little clinic, for practice. And after that, I decided, okay, I have some experience. I'll open my first private clinic and siga, slowly, step by step.
But being a private doctor is more profitable than being a
For
public doctor.
Yes,
especially in Ukraine,
I can tell you,
especially if
I
we talk
never
about
complain
Ukraine.
about anything, and I always feel excellent, an independent woman.
You like being an independent woman.
For sure.
I think being a doctor is pretty wow, to be honest, because I would never be a doctor. Like, I cannot see blood. When I see blood, I faint. I'm not there the right minute. Also, when something like extreme happens, I don't know, someone cuts their fingers in front of me. Actually, there was a situation. It's really embarrassing. It was like maybe 6-8 years ago, but I was a baby, Someone came to our house. They were working in the complex, and they cut their fingers off with that thing that cuts the grass, and they came to us with those fingers in their hands. It was really TMI. And there was so much blood, and you know what I did? I ran up upstairs because I was so scared of blood. I think if you want to be a doctor, you are destined to be a doctor, because I think if you can't look at blood properly, then you just can't be a doctor.
For sure, my doctor tell me now, Mom, I think I'm not going to be a doctor. I say, what, darling? I go to London. I will study about it. I think I will be a lawyer. Say, darling, I don't care. I just tell you one thing. If you don't want to be a doctor, I will not push you.
Yeah.
Because this is profession, not for pushing,
Yeah.
Me, I always wanted to be a doctor, and I can tell you, I wanted to be a doctor for children. You cannot imagine how I enjoy to help them, and I see it, how difficult to breathe, and after they breathe, they were itching their skin after they feel excellent. They came to me, Dr. Maya, they hug me. I'm the happiest woman in the world. I'm like very, very much that I'm a pediatrician. It's the best profession in the world.
For sure. No, if you're helping kids, I think that's what's the most interesting part about this profession. What is the most difficult part about being a doctor? A pediatrician, a doctor. Let's say a pediatrician.
I can tell you it's a very difficult education. Can you imagine? All my life I'm studying something. All my life. And to graduate this medical high school, it's already a lot. And I can tell you another thing, that you don't know what specialization you'll have. So we graduate all together, and after in some period you decided. For example, I was in the department where a lot of patients had severe pneumonia, severe asthma, severe allergic reaction, and I decided to be allergist. And in the beginning, it's okay, you need practice, but after you realize you don't have time to your private life, to your family, because all the time you're on the phone, somebody need you. For example, today I had only 45 minutes for massage. And I had a consultation, but my assistant called me and said, Maya, it's an emergent situation. And I saw the child had the problem with breathe. It's difficulties during the breathing, And I said, please, can you stop my massage? I need a piece. And I call and answer, I cannot be relaxed because I know that one child in Portugal now, he cannot breathe,
Yeah.
So this is your profession. You stop everything and help other people. And sometimes my relatives, my daughter, my friend, they suffer. Everybody know that we go to restaurant. If Maya stop and leave, it's okay.
Yeah.
They used.
Wow. So you have clients all over the world basically right now.
Yes.
It's because they migrated from Ukraine, or it's because
yes, and we started this from COVID, because in COVID we have a lot of online services, and people used already for online help. Because we couldn't imagine that medicine can be distant, help.
Yeah.
And during the COVID we started, and now we continue. And because, can you imagine now Ukrainian, they staying in the different countries, they came to doctor, they don't understand anything, no prescription, no recipe, no information, and they need extra opinion, extra meaning. And some client, when they go to doctor, say, Dr. Mike, can you be on phone? And I can speak with doctors. I can explain to my patient, to my clients.
Yeah.
It's very helpful.
It's also, I think it's a part of like customer service. The more you're open with your clients, the more they come. How many clients do you have now? Maybe around.
I cannot tell you, but every day more than 10 patients per day I have online for sure. And the people who know me, for example, I can help them by 2 voice SMS. I check your test, it's okay. I check your rash, it's okay. This is diagnosis not correct, For new clients, they need more attention, they need more time. But now, sometimes I don't have enough time for them. And I say, if you need my opinion, just wait for a while. Or buy my course for parents, or buy my course for doctors, because I have a lot of online courses.
Yeah. But, okay, you're saying online clients. The online clients, you have them for free? So you just open direct and you go like...
No, darling. No. Everybody paid.
No, I understand. But, okay, let's say I don't know you. And I find you on Instagram.
Okay.
And I send you a message saying, I don't know, I was diagnosed with this and this.
No chance, I will not read it. You say, Dr. Maya, can you find some time for me? I need your consultation. I need your information, your knowledge, your time.
So that will be a private consultation.
For sure.
Over Zoom or whatever.
Yes.
Between you and your client.
Yes.
Where it will be paid. Okay.
Okay.
That's interesting.
My assistant check the information, send all the information about our services. If they say okay, they paid, we try to find a time More convenience for me.
Because I saw that on your Instagram page, it's not your mobile phone.
No chance.
So that's how I was like, okay, I'm gonna.
And I can
like,
tell
talk
if
to
somebody
you.
called me on phone, I say, please, can you tell me where you find out my telephone? Say,
Where did they find your
this is
phone?
Larissa gave me. And I call Larissa next time. So Larissa, I hope next time you will not do the same.
I don't know how you responded to me, but the day that I texted you, I actually reached out to Anastasia. Because I don't, you know her, right?
Yeah, for sure, I know.
She's
Excellent girl.
Yeah, she's now the Kumbara, свидетельница на свадьбе у моей мамы была недавно. I don't know if she told you about me or you just saw my message.
No. She told me I gave you contact
to
one excellent girl.
Okay.
So if you're interested, don't say no.
It was like that because I texted you and I was like, okay, she's probably not going to respond. And then I texted Anya Sushko about you because I was like, for sure they know each other. She was like, I'm going to hit you up. And then you just responded to me immediately on Instagram. I was like, wow. Like, how much time do you spend on your phone? Do you know?
Yes, I think around 3-4 hours per day.
30, how many?
Yes, 3-4.
It's a lot.
3-4 for sure, it's a lot, and I should reduce it, you know?
Another good question as a doctor. How many hours should kids spend on their phone?
Oh, not more than 1 hour, and I can tell you the very important rules for everyone. 1 hour before you go to bed, don't see anything, you know? It's very important for the quality of our sleep.
That's for everyone.
For everyone. And now when I put that special program, installed in my phone, don't disturb me, close everything, change the color, everything, you know, just remind me, Maya, stop. It's better to wake up in the morning 30 minutes before that you need and do everything what you wanted in the nighttime. And because the sleep is one of the most important things in our life.
So how many days can you live without sleep? I think it's 3 days, right? They said 3 days.
me I think if I don't have enough time for sleep, I don't know, I cannot survive. For me, the sleep is one of the most important things. And in Cyprus, I had a possibility, and I had a short nap, especially in summertime, and it's amazing. And I like Mediterranean diet, so excellent here.
Yeah. Gastroenterologists say that it's okay to drink 1 glass of red wine every day.
Not every day. 5 times per week, it's acceptable. And even I had a video about this in my YouTube channel. And but not big glass. It's 150.
So are we talking about?
Yes.
Like this?
Smaller.
Like this?
Smaller.
Like this?
No. Maximum 150 milliliters.
Damn. So, okay. That's just red wine if we're talking about red wine.
Yes, because a lot of polyphenol inside. It's antioxidant.
Okay. What about heavy drinks?
Heavy drinks you can drink, but you can cut it, you know. So if we speak about Mediterranean diet, it's forbidden.
Yeah.
But some shots during the week. If we speak about World Health Organization, 0.
I saw that, but it's impossible.
For sure, it's impossible.
Nowadays, it's impossible.
Yes, I agree. For this reason, we should have some limits. Yes.
Yeah. Okay. Well, what do you think about men that are in the gym and they're constantly bulking? You know what bulking is? Eating, right? Isn't that bulking?
Because they need the protein.
Yeah, but okay, and also the people that drink protein. Do you think that's healthy, unhealthy? Is bulking healthy, unhealthy?
They should understand what quality of protein they use, because, for example, me now, I use sometimes protein shots because I cannot eat so much chicken or fish or nuts. For me, it's too much. And I know that I need a lot of protein per day. So it's not a problem. Okay, they should, first of all, take it from the food, and after extra dosage from powder, you know, but they should know how to choose it.
Yeah.
If they need a muscle, they will do it, you know.
I have friends that are bulking right now, and during lunch, you know, in school, they're constantly eating. So it's a salad, and then it's chicken and rice, 1 portion, and then it's just rice, the third portion. I don't understand. And then they're like, I'm not full. And they go and they eat more. I think it's unhealthy. I don't know. I would never
it depends
bulk.
about body mass index, about how digestive system work, what endocrinology. Maybe he has a
Yeah.
problem with endocrine system. So
Yeah.
you should advise him.
I will. Do you think gym is important?
Yeah, all the physical activity is
Physical
important.
activity. I'm not doing any physical activity.
Darling, I will change your habits too. No chance.
I think I should start doing some physical. It's not that I don't have. No, I
No.
don't know. That's the thing. It's
Step-
that I don't have time and I don't want to.
Darling,
I'm so bored
don't
to do
tell
it.
to me that you don't have time. Look at Dr. Maya's schedule.
No, okay. Yeah.
I today had my yoga class. I had my English lesson. I had my massage. I was cooking. I came here. I had consultation, and I had my Greek lesson. Can you imagine? It's only Monday. Very heavy schedule every day.
I can't imagine. And you live where? Ayanapa.
And now in Paralimni.
Paralimni. Po, that's so far away from here though.
Oh, it's nothing.
So okay,
30
it's
minutes.
nothing by the Ukrainian distances. I think
Nothing.
that's nothing, but for Cypriots it's something, you know. For
Cypriot-
them to say Larnaca to Nicosia,
we will change the
Larnaca.
Cypriots, because a lot of us here, so we'll change everything here.
Yeah. So gym is important.
Yes,
Physical
all the
activity
physical
is
activity,
important.
cycling, okay, skiing, everything you like,
This is
swimming.
this is another interesting question. Do you think cysts, kysty, might happen because of the lack of physical activity?
It's complex,
Mm-hmm.
It's complex immune response. It's everything. It's how, what is your food, what's your diet, physical activity, sleep, stress.
Is it better
supplement.
to keep a cyst or take it out?
It depends, you because some things can disappear.
With antibiotics
Not antibiotics, darling.
or without antibiotics? Oh, how does
Oh,
it disappear?
because-
I'm not a doctor.
Because different cysts in different places, different treatment, and different advices.
But how big do you think a cyst needs to be in order to take it
No,
out?
it doesn't matter. I can tell you that I had a cancer and it was so small noodle. So small one,
So no matter what size.
No chance.
Personally, I think, because I have a cyst right now, I want to take it out just in case for it not to develop into anything else. That's
For
what I'm
sure, and
scared
for
of.
this reason, you should be in the regular testing,
Testing,
to see the progression or regression, what's going on with it.
I also think that
process.
because I'm at the age where hormones are everywhere
can
and
be
stuff,
disappear.
it can be a reason for that.
Mhm.
So I don't want any issues. I have another question for you, a last one that I ask everyone. Where do you see yourself in 5 to 10 years?
I know. I will have excellent office in Paralimni Marina. With excellent view, excellent sofa. I will invite you for a cup of tea
I will
with
come.
an excellent environment. I will be very popular. I will be in here, and I hope everything will be okay, and I
Yeah.
can go to Ukraine, come back, because all my parents, relatives now in Kiev. I hope I will see myself in excellent form. I will speak English fluently, better than now.
You are speaking great English, don't
It's
worry
okay.
about it.
I never had in my mind that I will need it, but I will practice it. And I think I will be in Cyprus for sure, in this excellent, lovely island,
Yeah,
peaceful place with excellent people. I like
that's great.
this place very, very much.
I think Cyprus is welcoming you really well. Thank you so much for being here today. Thank you for coming and thank you for answering all the questions.
Thank you, darling.
Thank you. Thank you.